The best thing with clefts is that once they get the right treatment, the right management, you actually change their lives completely. They become normal. They are able to do what is supposed to be done.
All right.
And the reason why we have this kind of campaigns where we can help those ones who are affected by this disease is because that if we attack them earlier, we help them earlier in their life, you will find that they will be able to go to school when the time reaches. They will be able to speak properly. They will be able to have good features so that they have good looks, what we call the cosmetic kind of it. Then you satisfy the community and the parents because psychologically they find that that child is normal. Because the unfortunate thing is that if you, in our own communities, when you find a child who's deformed, it doesn't matter whether there's activity or everything, there's always that resentment. You feel that, oh, this is not a normal child, this is something strange here. You even advise other children not to go with it. And that, it affects the family. And you find these people normally don't even come outside. So it will be so important to say that you change someone's life completely. Because these people sometimes become very, they can become presidents of the country, they can become ministers, they can become doctors themselves. We have followed many patients, for example, who are now very senior in their own capacities of doing their work.
So once it heals completely?
It heals completely,
You become normal?
Exactly. I would like to add something what Jamila talked about. You know, most people ask that how has this disease come when the mother is giving the child. There are many causes that are caused. And they said one was he's talking about nutrition. When you look at it, you find that in most of the areas where most of our foods sometimes don't have certain things that prevent, you know, when the cells develop, like the face is developing up, the brain is developing up. There's certain things that if you miss them, you can't, like folic acid as he talked about. And then multivitamins, for example. So what happens is that if you wanted, they don't think they wanted to add on top of it. So look, if, let's say, you see, we don't have what we call planned parenthood, that you want to have your baby at this particular time. But if that was the case, one of the things that we could be able to advise that you start, you know, having supplemental folic acid and multivitamins 2 months before you conceive. And then thereafter, you continue when you're pregnant for about another 3 months. So that you know that everything, because the face develops within 1 month and 3 months, so normally it develops. It doesn't occur another different time. And the reason why you see clefts in adults is that they were not fixed at the time when they were young.
So